Next up is the Senior Care panel to be moderated by Carrie Graham. Professor Graham is adjunct professor at the USCF Institute for Health and Aging and holds a joint faculty appointment at UC Berkeley School of Public Health. The panelists from both the US and China will share the opportunities and challenges in senior care. Welcome the panel.
Hello, thank you so much for having us. And we're so honored today to be here to talk about senior care, both in the US and in China. Even before the pandemic hit, both the US and China were facing challenges with senior care and with our aging populations. Baby boomers in the US have officially entered retirement age, and China's only children's parents have also entered retirement age. And so we're here to talk today about what kind of life faces these two groups of seniors. Today, we have experts, and we would like to have a dialogue both among us and with you, the audience, on various aspects of senior care covering health policy, NGOs, and business opportunities related to senior care. As I was introduced, my name is Carrie Graham, and I'm a professor at University of California. I've also been acting as a senior policy consultant to Governor Gavin Newsom's administration to help develop a master plan for aging in California with a goal to transform how we care for our aging population in California. I'm honored to be here today to moderate this panel, and now I'd like to introduce our other esteemed panelists. I'll start with Allan He. Allan's a senior partner at Syndat, and he's responsible for its business development, investment, and asset management activities. And Allan, I just want to open it up to you and let you introduce yourself for a minute or so.
Oh, hi, everyone. Thanks for the invitation, and we appreciate the opportunity to speak as a panelist. Introducing myself and the company I'm working with. I'm a senior partner at Syndat Capital Management, which is a global-based, headquartered in Beijing, fund management platform. We specialize in real estate investment. Actually, 4 years ago, we started entered into this space with the mandate to we call learning with earnings. So the mandate is really to get into the space, seeking for the sizable cash flow driven real estate assets, and with the aim and also expectation of the growing demand in this sector. So far in senior living, we call senior living, or somebody calls senior housing. We have deployed about $400 million US dollar equity, invested in US and UK in a couple of portfolios. So right now we actually own about over 100 senior care facilities in US and UK. Well, since we are based in China, we certainly have the mandate and the goal to cover on a global basis, including China. So in the last 2 years, we also started looking at opportunities in China, although it's still very early stage. So in the hope that we can bring our experience and knowledge and the business operational model from US, from Europe, trying to put our step foot in China, hopefully grow our business at home. And lastly, we also been recently working on some initiative to float our assets in the global market, which is in the progress. I stop here. Thank you.
Great. Well, welcome, and we're so glad to have you. Next, I'm going to be introducing our panelist, Anni Chung. And Annie is the president and CEO of a really amazing community organization in California called Self-Help for the Elderly. It's a non-for-profit organization that provides a multitude of services. I'd also say that I really appreciate Annie because her organization has been a great partner to UC Berkeley in many research projects. So Annie, if you could just spend about 30 seconds introducing yourself. Oh, Annie, I think you're still on mute. Can you unmute yourself?
Sorry.
Yes.
Hi, everyone again. And thank you, Carrie, for the introductions. So I'm Anni Chung, and I'm the president and CEO of a community-based organization, as Carrie said, in the San Francisco Bay Area. We serve close to about 45,000 seniors a year. And we started in 1966. And later on, I'm going to go into our services, which is a pretty comprehensive elder care continuum. So I'll stop here because I know that we have some time limit, but I'll explain my services later. Yeah.
Great, thank you. Now I'd like to introduce Adam Tang. He's the Vice President of Tencent Healthcare. And Adam, would you mind introducing yourself for just a minute?
Sure. Hi, everyone. It's my honor to join this event. This is Adam Tang from Q Health Trusted Doctors. I'm the VP in charge of the operation and the business development. So currently we are the largest integrated healthcare service provider, both online and offline in China. So for the online part, we have over 450,000 physicians. And for the offline part, we have over 130 medical institutions currently in China. So today is my honor to join this event. Personally, I have dedicated over a decade in healthcare investment in China, including the aging care. While in my past experience, I have led several investments, both in China, Australia, and including US, for the senior care, for the nursing care, etc. Including the case like the largest senior housing company in America called Brookdale. So it's my honor. I hope I can share some more experience and my personal opinion regarding the industry. Thank you.
Wonderful, Adam. Thank you. Now, we're just going to start with 3 questions to give each of you a chance to answer before we open it up to questions. And I just do want to say to the audience, please send us your questions. We want to hear your thoughts and any questions you have for the panelists. But let's just start talking about some of the challenges that are both the US and China are really facing. Both the populations of the US and China are getting older at a really rapid rate. And in the US, projections have shown that older adults in the US by the year 2050, about half won't be able to afford housing, even if they liquidate all their assets. So we have some major challenges in the US. We also have challenges that our Medicare program, it's our healthcare program for older adults, does not cover non-medical services that older people need, like transportation, meals, or personal assistance that's not medical. So there's a lot of challenges facing older adults in the US. And I want to start with Allan. Could you share some of the
Hello. I don't hear.
Allan? Oh, there you are.
Yeah. Sorry. Sorry. Okay. I think although countries have difference, but US and China have something important in common: the aging population. So Carrie mentioned this census by 2050. I have the data right in front of me that in terms of population, China today has almost or even more than 200 million people over age 65 right now. And in US is also certainly catching up with the incoming baby boom generation, or arriving at the same age group. So by 2050, the US population, the same age group, will be almost 80 million. That's the latest number. So the challenge, if I can summarize, in US we see, as we've been in last 4 years, our experience, cost of care certainly is getting higher and higher. Cost of living, the real estate, is also getting more challenging, as Carrie mentioned. I mean, the early baby booming generation might still have a lot of equity, but along the time, people will be in less and less ownership of that size of equity. And thirdly is a shift of lifestyle for seniors. So today's seniors, I mean, if you compare with 20 years, they demand different lifestyle. Lastly, with the new medicine technology, seniors lives longer and longer. So that resulting in higher demand of healthcare. So these are the, I would say, 4 factors really challenging. So we might have opportunity to speak more in hopefully in following questions. In China, talk a little bit in China. It's different. I think the good thing is China is still in the very early stage, although the demand is already massive. So this is our advantage. We hope with the experience from US, from Europe, we can really help China to establish a good footing in terms of how this industry will develop, will evolve. So right now, the biggest challenge in China, I see, number one, the whole ecosystem is still not existing at all. I mean, when we talk about senior care, senior living, it's not like this piece of a home. I mean, you need a high level government policy. You need the financial infrastructure from government. So, I mean, in US, you have Medicare, Medicaid. In China, this is still under discussion. Certainly, the zoning, the land, the standards, most importantly, the financial support, not here right now here is just not existing at all. I mean, for example, I can share some experience. What we have in US, we are able to secure the HUD, the Freddie, the Fannie Mae. So those like a long-term 30 years financing to support this industry, low interest. I mean, it just doesn't exist in China. So I would say number one is the ecosystem is lacking. Number two is probably everybody knows. I mean, last 20 years, the massive growth of real estate put the land and the real estate very expensive. That created a huge hurdle for the seniors. Lastly, the culture and habit is a big issue at this moment, but this will getting better and better along the time. Hopefully, when the next generation, probably somebody 10 years elder than me, are much easier to be convinced to enjoy the institutional lifestyle of the senior living, as well as the new kind of new lifestyle, which is more fitable to their generation. Yeah, I think I stop here. Let's listen to others. Carrie?
Hello.
Yeah.
Hi all. For some reason I got kicked off the meeting, but let's move to Adam and have Adam. Can you answer the question?
Sure. Thanks, Carrie. So I'm glad that Allan had mentioned a lot of challenges we are facing, both in like China and America. I think the same thing we are facing for the entire world is the aging population. Then we all know the demand for the need for the like senior housing, for the senior care is very huge. But here I want to say in China, what I was saying is though the demand is huge, but as Adam had mentioned, the system is not existed, and there's no like actual need for the business opportunity. It's very harsh. So what I really want to address here is when we have the demand for the market, like we have over 210 million population over 60 in China, but that doesn't mean we can successfully earn money or making business opportunities from there. Because for elderly care, well, in all the countries, I think it's a social well-being business. I personally have visited like over 30 countries for different system for the elderly care, which I think the one thing is the same, the payer. There always will be a final payer for all the healthcare service, and that will be always either the insurance or the government. So in China, I think the social insurance will be the final solution to everyone, but that is not enough. Like currently, we only have 60% of the population have covered by the old age pension fund. The other 40% is zero. There's nothing else. So how to care about this population is very difficult. And with the lack of the government and the insurance partner to join the industry to support the people for the payer, for the payment, then there will be no funding for the industry to develop. That's a problem we are facing. And on the other hand, with the increasing human cost and very expensive land cost, it makes elderly care very hard, the elderly care business very difficult to move on, to move forward. And that is why, although I've invested in several elderly care projects in China, and what I see in the entire industry, I didn't see anybody making the proper profit and make break even is very difficult for almost all the players. I think people always think like the players, they making money is not social well-being or something. But in my mind, if the providers here in China, they cannot make money, then who will actually do the service for you? With no funding, with no support from the government, with no support from the insurance partners, then the industry is very difficult. So to develop to develop the opportunities here under such a circumstances, which I think we need to plan a long run, probably over at least 10 years. Plan long and do something for the future that will be more interesting and can be the actual plan for everybody. Yeah, thank you. Carrie, I think we've lost you.
Yeah, she's dropped.
Yeah,
maybe Annie,
you can directly. Yeah.
So I should just go.
Yeah, I think so.
Yeah.
I think so. Oh, maybe. Okay, so I'm Annie again. So hearing from our two speakers, I get really worried because, you know, like in the United States, when our population elderly over 65 is like 16%, but when we get to the number that Allan mentioned, 200 million, you know, wow, we're really going to be in a crisis mode. So I think that there's a couple of interesting statistics about the baby boomers, whom I think that we all are. And for example, in the United States, there's around 73 million baby boomers, right, who are born between 1964 to 1946. And a couple of interesting stats that says that every day now, 10,000 baby boomers will be turning 65. That's an awesome number, you know, huge, huge number. And in another maybe 8-9 years, they said that by 2030, even the youngest boomer will turn 65. So I think that our senior population in the United States is really spiking, and that presents really huge challenges, just like Allan and just like what Adam said. So in San Francisco Bay Area, as I mentioned earlier, that our organization started in 1966. And I have to, let you know that out of the 40 plus 45,000 seniors we serve in 5 Bay Area counties, 90% are low to moderate income seniors. And that means that their average income is probably anywhere between $500-600 to maybe $1,500, maybe $1,800 max. And they live on Social Security. 40% of our seniors have Social Security as their only source of income, which that is not going to last too long. So funding, a lot of the senior services of what we call senior care or elder care, our challenge on the ground, looking at all of the needs from this growing senior population, but yet both government sector as well as some private sector just are not keeping up with the pace of strengthening and expanding the infrastructure so that we could serve more seniors that are becoming aging. And also when Allan said that our seniors are becoming living longer, right? Longevity, our average lifespan is definitely longer now. Then we're sensing that our infrastructure is going to not keep pace with the growing need of, let's say, seniors that have Alzheimer's and dementia, because statistics show that for elderly that are 85 plus, there's a 40% of Alzheimer's. That means almost 1 in 2 seniors could get dementia in their lifetime. And that alone is going to eat up a lot of our medical dollars as well as resources. I think that in the United States, we are lucky that we have Medicare, we have Social Security. And as I travel back to Hong Kong and China, that question always comes up: how do I fund long-term care, right? We have medical care, we have some home-based care, but how do you pay for when elderly start to have to live in nursing homes and skilled nursing, get rehab and other types of senior care that is very expensive. So again, on the ground, as Shelter for the Elderly is a pretty comprehensive elder care service. We provide affordable housing. We provide a licensed home care and hospice program. We provide residential care services for Alzheimer's seniors. But we also have a lot of services that are just based on what our seniors need. Out of the 45,000 seniors, we serve about 90% are Chinese seniors, and they come with different dialects, and they come with different needs. But our biggest challenge in the affordable housing is exactly what Adam already said and what Allan already said. The cost of building housing is getting skyrocketing. So it almost, in the US, it's almost like $1,000 for every square foot, even affordable housing that we are building. So normally 30 years ago, when we build our senior housing, it's about $100,000 per unit, right? It's a small 1-bedroom or studio. But now if I go and build senior housing now, it's gonna take many more millions of dollars. I forgot what was exactly. For a very small studio apartment, it's gonna be like maybe $1 million. The costs have risen like 10 times. So now, even when my seniors apply for affordable housing that the city is trying to build quite a few units, it's going to take at least $2,000 income to be qualified to live in affordable housing. That's how bad the situation has become. And government, that US government is going broke. There's going to be less and less money to build affordable housing as well as providing healthcare. So I'm very concerned as a community-based organization that first, there's not enough resources to support the current infrastructure, and there's definitely going to be less and less resources in the future to expand our services to accommodate more seniors. So all these are very critical challenges that we face.
Very, very concerning. Thank you so much, Annie. Those are such important comments. So I want to make sure we give enough time for questions. So I want to go around with everybody and have you say, what is the one most important innovation? If you could wave your wand and have an innovation that address senior care today, what would that be? What would your top choice be for an innovation? Mine would be technology and bridging the digital divide, because I think the pandemic especially, and this 5-6 month long shelter in place has showed us the social isolation of seniors and them not having access to Wi-Fi or broadband has been a real challenge in California. So that's what I'm going to say. Let's start with you, Annie. Wave your wand and tell us the one big innovation you would do today.
Definitely to help us bridge the digital divide. Really, Carrie, you nailed it on the head. During COVID, a lot of our seniors really need to be connected. We were providing them the meals because we delivered the meals to them. But so many need to call us every day to ask us how to do this, how to do that. And only about maybe 3% of our seniors got on Zoom and learned how to use it so that we could video conferencing. So if there's anything coming down, I needed people to help us bridge that digital divide.
Yeah. Allan, what would you say? What's your one big innovation you think would solve everything?
Yeah, just a piece of experience. We own those skilled nursing facilities in US. Well, I see a trend of integration between the healthcare system, hospitals, and the nursing homes. That actually created a lot of synergies, integration, and a shared service. And with that in mind, it also make easier to get into the technology, because traditionally nursing home are more behind in terms of technology. So if this is happening, what Annie mentioned, those technology, for example, telemedicine. You can visit the physician through the web conference, wearable device, all those mobile urgent care. That become more available, easier if this is happening.
Wonderful. Thank you. So important. Adam, can I ask you to tell us what would be your one top innovation?
I think it's online and offline integration to leveraging the technology to generate a business like model for the industry, which is more important. Well, which I mean, currently our company can providing like online healthcare service. We like for telemedicine, for delivering the medication to your home by fast pass delivery, which we can cover all the cities in China and can deliver the medication from like 2 days to 4 days, and some big places we can deliver the medication for like within 30 minutes. And also we can providing all the medical care and the healthcare service from the offline each big cities currently in China. By this online and offline integration, we can on the maximum scale to decrease the cost for the services. Like the doctor, like the physicians, they are very expensive, but using the online way, we can, using the telemedicine, we can certainly save the cost and also help a lot of countryside to meet the actual like expert physicians in the tier 1 or the tier 2 cities. And in the meantime, for the offline facilities, because we have the business from like a traffic portal, we have the online consultation, telemedicine, which I can earn a lot of different traffic of the users, of the patients, of the aging people from different portal. And also we have the like GP clinics, we have the medical centers collaborated with the government. All these become the traffic portal, though they didn't make break even or earn enough money, but that can earn a lot of enough like traffics for us. And then we have the senior care, we have the specialist care, we have the day service centers. This can become our like a profitable portal. So we just established a circle to taking care of the people's like a lifetime different healthcare needs. From your birth to your end, that's what we are chasing for. And we earn the profit for different stages and for different products, and for the general care, primary care, all these, we just maybe break even, that's enough. But for the others, if you want to have some dental care from some eye clinic, or just you want to purchase some good like glasses, then this can become our profitable business. Then we can make the entire circle running. Because we can sometimes we make the we lost some money there, but some other places we can earn the money back. Then we can take care of the entire people better, and we hope that's the business model we can establish. Yeah.
Great. And so we have just like 1 minute before we're going to go to questions.
Okay.
So if there is a call to action, everybody gets 10 seconds to answer this. For the younger generations, for the students at UC Berkeley, for the younger populations in China, what would be your call to action for them? Let's start with Annie.
Carrie, when I visited your class and Winston's class, I always end by suggesting all the students to come volunteer as self-help. Come volunteer on a regular basis, maybe, but come volunteer during special events like Thanksgiving. You know, it will be really wonderful experience for all the students.
Thank you, Annie. Allan, what would be your call to action for the younger population?
Well, similar to Annie, there's strong demand for young people to be in the industry. So either you go join the senior care operators, get some training, or spend some time in the senior care centers. That's a starting point.
Great. Adam, what's your call to action?
I think as well, go to meet your parents more and find what they need and consider from there. Because if you really try to take care of your own parents, then you always will find the right thing to do for the industry, for the country.
Yes, wonderful. Thank you all. We have a lot of great questions here. So I'm going to start with this question about multi-generational living. Multi-generational living is a new concept where seniors age in the community with people at various life stages. What is your opinion about this new model of senior living, this intergenerational living? Anybody want to answer?
Maybe I go first.
Okay.
Actually, this model I've seen in Netherlands. I've been there meeting Dr. Beckham, or sorry, I forget the exact name. They just created the model like elderly people living there, but in the meantime, the younger generation, the different people are living in the same community, same building actually. So that makes the elderly people, they feel they still live into a normal community and feel they're connected with the society, not like the other traditional elderly care. The elderly population, they are isolated from each other. They can only meet the same age people, which really makes them feel very terrible feeling. By the academic research, especially the children and the elderly people, they can live together. They have the same needs, and in the meantime, the children can really help the elderly people escape from the dementia, from the other issues emotionally. So I think it's a good idea, but how to make it very safe, and the care needs, the nursing care needs, the actual more intensive care needs can be satisfied. That's a challenge facing to most of the countries if you want to building this model. Yeah, that's what I want to say.
Annie, do you know of any intergenerational living, senior housing? I think in the US, there are a few models, but maybe you know more than I.
Most of our subsidized housing, affordable housing, comes from federal funding, right? But they are so restrictive, Carrie,
yes.
that, for example, even if a couple that lived in a one-bedroom, right, and then one of the spouse passed away, almost within a few months, we have to relocate that resident into a studio. So the restriction really limits. I love it because our culture really stresses on family, taking care of each other, right? Extended families should always, if possible, live together because you then give a lot of support, right? Babysitting, but as well as elder care. So I don't know, we have to go advocate. But Canada, Carrie, I heard that in Toronto, when they build a senior complex, then close by, they build some family housing. That then the family could live there. So I thought it's a model that we could look
at. Well, talking about Canada, actually, there is one already open in Vancouver.
Already open.
Yeah, they don't call multi-generation, they call generation living, something like that. It's just starting. In my opinion, it's interesting, but a lot of challenges in terms of standards, activities, food. I mean, different needs. So we'll see. I mean, but it's good to have this kind of experiment to experience.
In California, they have made it easier for families in single family homes to build what's called an accessory dwelling unit in the backyard. Some people call those granny flat.
Yes.
And so they've made it very easy. There's not, it used to be more restricted, and you could build these tiny homes in the back of your house, either for you to bring a parent, or maybe when you retire, you move there and rent out your home. So that's the closest I've seen in California. But let's move on to another question from the audience. One question is, China is heavily promoting automation in many areas of the economy. Will the automation shift be fast enough to catch the demographic shift to an aging population so that its economy can be sustained? What is the role of automation in senior care?
Automation. Sorry, I didn't
robots.
Catch.
Like robots.
Yeah, like robots.
Personally, I don't believe in currently the robot service for the elder care or even the entire healthcare service, which currently the quality and the service they can provide is very limited. In the long run, I believe the auto service can replacing most of the manpower, can save a lot of cost. That's in the long run. But for the next 10 years or even 15 years, I didn't see the service can be easily replaced. It's like human touch.
Yes.
For China, I mean the entire healthcare industry, at least for the medical side, I didn't see big change for the last 30 years. So I think
we're trying so hard to fight social isolation. We're trying so hard to have human touch and human interaction for older adults, especially during the pandemic. The idea of using robots just does not seem to
scary
solve that problem.
That's correct.
So one question is, what is the more favorable locations for senior housing, urban or suburban?
Yeah, I may address that. That's an interesting question. It's changing. If you look at US, if you look at our facility we own, it's all in the suburban. But starting last 5 years, you will actually see high-end facilities open in Manhattan, Midtown. You also see those in Toronto, in Vancouver. It's all in the urban area. I think definitely it's changing because the new generation, even the young generation, tend to go back to the city. So this is also happening for the seniors. In China, I mean, for the next 10, 15 years, I think it's all urban location. Those like suburban resort type care homes are actually, I'm sure it's going to fail. It's just for the result for tourism. Yeah, that's my opinion.
Yeah, because a lot of the times when we provide aging service, we have to think and include transportation, right? It's really important. Without transportation, a lot of the seniors would kind of like be imprisoned in their own homes, not able to go out, right, when they lose the mobility. So I think urban setting closer to transportation, easy access, to groceries, or even getting a caregiver or a home health aide to come in to take care of you. But if you live too suburban, it's really hard for a caregiver to travel 2 hours just to get to your place and spend another 2 hours coming back to the city. So when we look at caregiving kind of in a holistic manner, somehow in San Francisco, a lot of the really affordable housing projects are built close to where services are.
Yeah. Another question from our audience is about Japan. It seems Japan is in the thick of challenges of an aging population. Any key lessons learned from Japan and Japanese culture?
I've been there watching their healthcare aging service industry. I think one thing very unique is they developed the hospital aging care facility and like a home care facility within the same building. That's very interesting. I copied that model to Suzhou. Because I think to Chinese and to probably the Asian population, when you do aging care, I mean senior care, the medical support is essential. You have to have these doctors on the way and to prepare the best quality for that and in the same time. And because you can make it in the same building, we can lower the cost, we can share most of the common places, and we can build up, as I mentioned, the integration model. So from Japan aging industry, I think this model is very advanced, and we can try make it happen in China.
Very interesting. I want to bring us back to something I had said at the beginning, which was some models by researchers at Harvard and other universities looked at seniors all the way through 2030 and 2050 in the United States. And they found that even if half of those seniors will not be able to afford these kinds of senior housing. They also found that if they liquidate their assets, still many will not be able to afford senior housing. So what are some ideas of making senior housing more affordable in the future?
So Carrie, just something my colleague has been, we have been noticing. There are something like they call shared residential home. Mm-hmm. So you can remodel the existing residential homes to house seniors and welcome them living together. So that's something happening in US, certainly not in China yet. There's also like we call affinity focused lifestyle. So to convert some existing facilities, focus on attracting residents with common interest and same background. So that's similar to that concept, so-called shared residential homes. I think that's one area I see because you just cannot, only rely on those institutional senior living, which anyway, USA is in the highest percentage, is only like 12%. I guess by 2050, probably 20%, that's the most. So you still need a lot of community service center, as Annie might be has experienced. This new concept, shared residential service, all those things. I think that will develop in a big way.
Annie, have you heard of this model that is being facilitated by many social service agencies, which is
Like
shared
shared.
housing.
Yes.
Are,
And
are you working on that, and how is it working?
yes, when the eviction, right, started to come several years ago in San Francisco and Bay Area because of Alice Act, and there were so few housing that is available that an average income senior could afford. So we started to match seniors to really share, like they might have a 2-bedroom, you know, so we try to match someone who's compatible. The process is slow because I think that in our culture, Chinese tend to be very cautious, and they ask a lot of questions, and you know they don't want to sign the contract, you know, until they are sure that they could live together. But we have maybe 5 or 6 successful case. But I think as social service agency, we have to stand by to give the support, because you know, when you put 2 strangers together, they're bound to be conflicts. And we just have to have patience to work it out. But if senior, particularly retirees that have a large home, but all the children, grandchildren gone, you know, their house is paid for, but they don't have a big income. And if they don't want to sell their property, finding a good tenant to co-share the space is actually a good idea. So we're going to probably spend more efforts to do it, because there's hardly enough affordable housing units built in the city.
Yeah, I think that's so important. We have, that's a big problem with housing and housing density in Berkeley, California, where I live. There's one street in a nice neighborhood that has 9 houses on the street. All the houses are 4-bedroom houses.
Yeah.
And every single house has one older woman living there.
Mm.
But I do think you're right. There's going to need to be some agency like yours that helps people work out the contract and work out conflicts. So I'm glad to hear that you're working in that. Okay, so one final question. I'm a Chinese person. I'm coming to the US for graduate school, and I'm working in San Francisco right now. My parents are getting older, and I'm thinking about bringing them with me to the US, but they don't know English and US culture. What suggestions would you have for me?
Oh, it's happening now. I mean, in Bay Area, in Seattle, in Vancouver, you should go there and you'll find those Asian focused, pretty nice. I have friends, they put in their parents there. I think there's a good opportunity in terms of business development. There's so many Chinese, because culture is different, food is different, lifestyle, I mean, still different, at least for the current generation. So that's good business opportunity, in my opinion.
So a business opportunity mean create some senior housing that's specifically focused toward different language groups or different immigrant groups?
Immigrant, yeah.
The question is, Carrie, that I will ask the person who asked the question is, do they intend to stay in the United States? Because if after graduate school, you go back to China, you know, you don't want to just leave your parents here. But if you do intend to stay, then I would say come to San Francisco. You know, like your parents will feel very much at home, almost like China, because we have a very really a wonderful community that supports seniors that don't speak any English at all. So don't be worried.
To me, other than like a business, personally, I would suggest probably ask your parents more. Do they really want to move to a new, really new world? We can use the word. We've done some researches. Most of like the aging population, they just want to stay where they are really they are very familiar with. That makes them feel better emotionally and physically, actually. So if they really want to try something new, then bring them to America. If not, maybe you can come back to China more often. That will be easier.
That's great. Okay, we just have a couple minutes left. So I want to thank all the panelists for being here. Does anyone have any final words of wisdom for us about senior care in US or China? and things to be on the lookout for. Final words of wisdom.
Oh, it's all challenging. That's all I can say.
Yeah.
Yeah, survive. That's a word you should chasing in the healthcare industry for aging population.
Yes, yes. And with the COVID pandemic in the US, I can speak for California. We began doing the master plan for aging, where the governor of our state wanted to have a transform aging services. We started this planning process when we had about a $17 billion surplus in our budget.
Mm-hmm.
We ended the process last week with a $54 billion deficit. So it really, COVID has really changed things. And, but I do think on a word of hope is that it has brought attention to some of the issues and challenges around aging. And I do think that we have a window of opportunity to make some changes. People care about older people. People have seen what the pandemic has done. And so I think as much as we can act in this window of opportunity, we should do so. So yes. Thank you all for being here today.
Thank you, everyone.
Yeah. Thank you, everyone.
What a thought-provoking discussion. The challenges facing the senior care in both countries are concerning, but technology innovation and also sharing the experience and practices may give us hope. So thank you for the panel's phenomenal presentation.